Hi folks, my name is Kiersten DeFluri and I'm the Medicare specialist here at Dan White & Associates. I hope you all had a wonderful Christmas with your families and are getting ready for a wonderful new year. Today we're going to be going over all of the changes for Medicare for 2024. So get ready, let's buckle up. All right, so let's get started by going over the changes for Part A and for Part B. So for Part A, your first 60 days in the hospital, you have a deductible. The deductible did increase by $32, so the new rate for that is $1,632. For days 61 through 90, you had a coinsurance of $400 a day. This is now increased to $408 a day. For days 91 through 150, these are known as your lifetime reserve days, and you get them once in a lifetime. That number has also increased to a total of $816 per day. And then, of course, we know they say after 150 days, you're on your own, unless you have some sort of supplemental coverage. Also, with Part A, there's skilled nursing facilities, and we know that the first 20 days are covered under your standard Part A benefit. However, days 21 through 100, they do have a daily coinsurance, and for 2024, that rate is $204 a day. Going into Part B changes, so we have an increased premium for Part B that is going up to $174.70 a month. We also have an increase to the Part B deductible that was set at $233 for 2023. In 2024, they're increasing that deductible to $240. All right, folks, now we're going to transition into the Part D changes, so the drug plan changes. First thing is that the deductible has increased to $545. Now, all plans don't have a $545 deductible. This is just the maximum deductible that they're allowed to provide for 2024. We also had changes to the thresholds for the donut hole. So that new threshold is $5,030. This is what you and your plan have to pay to get into the donut hole. Once you're in there, you're liable for 25% of the retail cost of your prescriptions. To get out of the donut hole, that threshold has also increased. For 2024, that threshold is $8,000 that you and your plan pay combined. Once you reach that threshold, your prescriptions will be 100% covered for the rest of the year. Okay. So also one thing to note in there, I know that $5,030 and $8,000, those are some pretty high numbers. Please keep in mind that CMS, which is the Center for Medicare and Medicaid Services, they have it in their pipeline to cap the out-of-pocket prescription costs at $2,000 for 2025. So we only have 1 year left to go, so please hang in there, and I know we're all excited for that great change. Alrighty, so now we're going to go ahead and talk about the changes for Herma. So Herma, for those of you who don't know, is an income-related monthly adjustment amount. So good old Uncle Sam says that if you make too much money, he wants more of it back. So with Herma, we know that they look 2 years back. So in 2024, they're going to be looking at your 2022 income. But the good news is that the thresholds increase each year to keep pace with inflation and the cost of living. So our new threshold for 2024 for single tax filers, that threshold is increased to $103,000. For folks who file jointly, that threshold is being increased to $206,000. So we have about a $6,000 to $12,000 increase from 2023, depending on the way you file your taxes. All right, so now what I want to do is go over what you can use your HSA funds to pay for. This has been a big topic throughout my meetings this past year, and I've had a lot of mixed information on what you're able to use those HSA funds for. So I just wanted to go ahead and clarify that for everyone. So you can use your HSA funds, your health spending account funds, for qualified medical expenses. We know that you can't contribute to that fund once you get on Part A, but you can still use the funds that you have accumulated. So some of those qualified expenses include your Part A premium, if that's something that you're receiving. Not many people do. Part B premiums, you can, if you're getting that premium taken from your Social Security benefit, you can go ahead and submit the premium for reimbursement to your HSA account. Okay. You can also pay your Part D premiums, your drug plan premiums with those funds. You can pay Medicare Advantage premiums with those funds. You can also pay for your co-pays, co-insurance, any costs that you have for dental and vision. But the one thing that you cannot use your HSA funds for is to pay your Medigap premiums. That is the only thing that you are not allowed to use those funds to pay for. Okay. I know that was, again, a big concern for some folks. So I just want to let you know that you are able to use those funds, especially for the Part B premium, because not many people know that. Okay, so the last thing that I want to go over is 3 changes that are happening with Medicare for 2024. So the first one is to telehealth services. Telehealth services will be continued to be covered by Medicare for the rest of 2024. After that, they're no longer going to be covered. You will have to go see your providers in person in their office. There are some exceptions to this. For example, behavioral health or seeing a therapist, that's something that is still going to be allowed virtually. However, again, after 2024, they are going to require that folks go into the office to receive their care. Number 2 is managing and treating chronic pain. So what they're doing for 2024 is for folks who have had chronic pain for more than 3 months, they are allowing for monthly managed care plans to help cover those costs. Number 3 is better mental health care. So starting in 2024, Medicare will extend its coverage of intensive outpatient programs for mental health provided by hospitals, community mental health centers, and other locations if you need mental health care. Also, for the first time, mental health counselors, marriage, and family therapists are also being given the opportunity to get contracted as Medicare providers. So allowing those services to Medicare beneficiaries like yourself. So these are the last 3 topics that I wanted to go over with you, and I wanted to say thank you for listening. I hope that the information we shared here today you'll find valuable. And if you have any questions, comments, concerns, my door is always open, so please feel free to email us, give us a phone call. We're here to help in any way that we can. Thank you.